Everybody, today I welcome you all to learn about the motor neuron disease. Motor neuron disease is a very important disease in respect of neurology. For exam, it is also important. So, motor neuron disease, it is neurodegenerative disease. There's neurodegeneration is there. Okay, so the main problem is here all the nerves, okay, specifically not all the nerves, the motor neurons, that in the disease name you can understand the motor neurons will be affected. So upper motor neurons or lower motor neurons, or neurons in our brain and brain stems motor nerve nuclei, and in the cortex in brain there is cortex. In cortex also contains the motor neurons, so those will be affected. Now how you will understand the symptoms. The mainly the age is a factor. In age it is saying that more than 50 years are mainly affected, and 65 years is average is common to be affected by it. Males are more affected than usually the females, so it's a male predominant disease and disease of age, because below 30 years it is not commonly seen, it is rare. So in clinical features, there will be feature as I mentioned, the upper motor neuron, lower motor neurons, and the bulbar symptoms will be there. But most importantly, patient will be the limb weakness. He will come with the limb weakness. So limbs like upper limb and lower limb, these will be there will be weakness in be there, and this weakness and cramps will be there, and the patient will have symptoms like twitching, muscle twitching will be present. The automatically muscles are twitching present, so weakness and muscle twitching present. Then there will be difficulty in swallowing, difficulty in speech problem. So in speech problem we called it these are three, and in swallowing this is dysphagia. Okay, so dysphagia, dysarthria problems will be there, and some cognitive problems. So cognitive or behavior problems we will find. So cognitive problems like fronto FTD, there is a frontotemporal dementia like symptoms will be there. So in sign we have seen the problem. Now in symptoms and in sign you will find there will be muscle limbs atrophy, there will be fasciculation. The twitching is also known, another name is the fasciculation. So muscle atrophy, fasciculation, okay. Then weakness, as I have mentioned, weakness. The weakness, atrophy, fasciculation will be present. Secondly, there will be reflexes, upper motor neuron reflexes. The reflexes will be brisk reflexes. There will be spasticity present, and Babinski syndrome. The extensor plantar response will be positive. Like if you examine the extensor plantar response, then it will be extensor. So Babinski sign will be positive. Okay. So these two things that I have mentioned. Another thing, there will be no objective sensory problem. So no sensory problem. So here it is written, there is no sensory loss. Okay, no ocular muscle will not be affected. So no sight problem, no sphincter related problems, like no there will be no issue with urination or bowel problem. So no sight, sphincter and sensory loss. Again, there will be some cognitive behavioral problem like frontotemporal dementia, and upper motor neuron sign like facilitation, atrophy, weakness. Lower motor, upper motor one like reflexes, spasticity, Babinski sign positive, this will be present. Bulbar symptoms like weakness in the palate, tongue, then the face muscle will be present, but eye muscle will be spared. Okay, and there will be no objective sensory loss. Okay, and it will be progressive disease of starting there, it will be focused in one area, then the disease will steadily will involve all the areas, and there will be ultimately respiratory muscle involvement will be there, and respiratory type 2 failure commonly seen, and patient may die from respiratory type 2 respiratory failure, obviously. So this is the feature of motor neuron disease. And lastly, but I want to say, if we find the whole feature, upper motor, lower motor, then we tell it the ALS variety, that is the we know known as amyotrophic lateral sclerosis. And another one is the lower motor, upper motor variety, and another one is the only lower motor variety type. One is the primary sclerosing, and another one is, I think I forgot the names, but these are important. So ALS variety, upper motor neuron variety, lower motor neuron variety, and the bulbar involvement variety. Only bulbar related features are there. So I can say that also upper motor neuron is known as the PLS, primary lateral sclerosis, and the lower motor is PMA, progressive muscular atrophy, and bulbar palsy, which has the worst prognosis. Thank you very much for listening to me. You will learn about the management of the motor neuron disease. It's a neurodegenerative disease that may be discussed in the neurology. So motor neuron disease management. How we will manage motor neuron disease? Number one, you cannot manage a motor neuron disease alone. It is a multidisciplinary team you need. In multidisciplinary team, you need different people. You need a physiotherapist. You need speech. Problem is there, so speech therapist. His daily function may be improved by the occupational therapist. Then you need a dietitian to improve his feeding and feeding support, ventilatory support if there is respiratory problem, and last but not the least, palliative care team support in the last days. Okay, so you will need in different support, and obviously the neurological respiratory support is there, must be needed. Secondly, there is a drug, it is known as the Riluzole. This drug is very much important because it reduces or it increases survivability. It cannot halt the progression of the disease, but it's the speeding up of the disease it reduces. So it important, it's a glutamate antagonist. In 2 to 3 months survival is increased by this drug. Okay, then you may need NIV support, as respiratory failure is the main problem for the cause of the disease here. So to prolong survival and improve the life, you need the NIV support. Then you may need the feeding support by support a PEG tube, percutaneous enterostomy you can do, you can say that by PEG tube support. Okay, and last but again the palliative support, team support. So again I am reviewing the what you will do in a case of management of the motor neuron disease. In a motor neuron disease, its management very much important. You need a multidisciplinary team, physiotherapist needed, a speech therapist, occupational therapist, dietitian, feeding, ventilatory support, palliative care team support needed. You need a drug, it is the Riluzole, it is glutamate antagonist, so it reduces the glutamate function or presynaptic neuron, and ultimately that causes the excitation in the muscles is stopped or reduced. So Riluzole is important drug, non-NIV. NIV is non-invasive ventilatory support, ventilation for respiratory support, very much important. Feeding support, you can give PEG tube or enterostomy tube through the the mouth or oral cavity, as feeding will be critical. Then this tube will help to give him direct feeding support, and last but not the least, the palliative care support. Okay, that's all. The management of the motor neuron disease. Thank you very much.